Well, folks, over the years, I have been rescued from a ski slope, I have been cut out of a vehicle, and I have had all kinds of different first aid procedures done on me, but never in the air. Hi, welcome to Around the Town with Marilyn Forbes. After many years of talking about it, I finally reached out to LifeFlight, and they've been gracious enough to say, sure, come on up and do a show. So David and I are here in Butler today, and we're going to be talking to a couple of the nurses who are going to explain the procedures that they do and how they take care of you when you're in the air. And we're going to talk to the pilot. He's going to tell us all about the helicopter, and we're going to learn all about this great program. So please, sit back, relax, and enjoy the show. Well, folks, as promised, it is my pleasure to be here today at LifeFlight, and I have with me KK and Ash. Ladies, thank you so much for joining us on the show.
Thanks for having us.
We're here at Butler, and so tell us, what's LifeFlight?
LifeFlight is an emergency transport service. We cover within about 150-mile radius of the Pittsburgh area. 911 calls anytime they need us for advanced life support.
And we also do inter-facility transports, taking patients from outlying facilities that need a higher level of care, generally into closer to the city, into the bigger facilities.
Okay. Now, do you, as far as calls in general, are most of your calls from facility to facility, or are they from scene to facility?
It's probably 20 to 30% are the actual scene calls, and 70 to 80% are the inter-facility transports.
Okay.
Definitely during the summer, though, May through October, we call it trauma season. You know, the weather's nicer, everybody's outside. Our scene volume goes up a lot. Yeah, we get a lot busier.
Oh, okay.
Yeah.
All right. Now, as far as you ladies, you're nurses.
Yes.
So what differs what you do or how you can do it from a bedside nurse? Bedside nurse?
Yeah, bedside nurse. So we were bedside nurses. Right. My background is mainly emergency department with a little bit of ICU. And KK?
I am ER and ICU also, and a smattering of other things over the years. But
and you have to have what, 5 years?
5
I
years.
understand.
ICU,
you qualify.
critical care.
Now, how long have the two of you been doing this?
I've been 2.5 years, almost 3.
I'm almost to 2 years.
Yeah.
Okay, so now I want you folks to understand, I didn't realize until we were here that they actually stay here on scene. They are here 24/7. It's a rotation, from what I understand.
We work 12-hour shifts.
12-hour shifts. Okay. So then, anytime that the
tones go off.
Thank you. And the tones goes up, you guys are ready to go. Now, about like how long does it take you from call to actually get on and be in the air?
So from the time dispatch pages us, we accept the flight. We have 7 minutes to get in the air and lift.
Really?
Mm-hmm. Yeah.
So then I'm assuming then probably the lion's share of what you're having is already on the helicopter ready to go. It's just you physically getting whatever it is you. Now, how do you just dress like this, or is there a certain way that you have to dress, or a certain more type of?
We have this, and we have our helmets, and we take our medication and our blood bags with us. But it's this. These are flight suits, and they're made of Nomex, which is supposed to not catch on fire.
Oh, okay. Once you guys are on the helicopter itself, exactly what are you equipped to do? What type of trauma, what type of injuries are you equipped and able to take care of?
Honestly, pretty much everything.
Okay.
Anything from an airway, taking care of trauma patients, neuro patients, pediatric patients, geriatric patients, patients that maybe have just like newborns in the field. We cover it all from brand new to the elderly.
So it's a broad range. You know, you never know every day when you come to work exactly what you're going to be doing. Yeah.
It sounds almost like you're like an emergency room in the sky, to be perfectly honest with you. I mean, really, it sounds like you can do just about everything.
We can do a lot of things, and every once in a while our physician leaders will work with us, and they'll run a shift with us, which is really nice too. They do tons of education with us. We have 3 or 4 education days a year where the physicians are there and they're training us. They send us to a cadaver lab once a year to practice on cadavers, doing intubations, finger thoracostomies, escherotomies,
Yeah, so that we
stuff
can
like that, so that
So
we
the
can.
education is ongoing
Oh,
then for
the
you.
education
Continuously,
is
yeah.
continuous. They're constantly challenging us to learn new and different things.
Oh, wow.
And the medical directors actually wrote our protocols, which is what we follow. So we're not just going rogue when we're taking care of these patients. This is actually one of our protocol books here, and it has, I mean, anything from, you know, you come up to a pediatric trauma patient or a pediatric brain injury or a burn patient, and so it gives us a way to kind of treat the patient. So we're following protocols, and then if we get through a protocol where, you know, the patient isn't just fitting the picture that the protocol book kind of helped us to get through, we can call medical command and just get some advice, or they'll point us in the right direction saying like, hey, you know, we've done all of this, this is what we have. Do you have any ideas, or is there anything else we can try to get this patient to where they need to go safely?
So they're just a phone call away, then, basically.
Yep.
They're a phone
And even
call
in
away.
the air, we can get them on the radio.
Oh,
So
wow.
we do have them all the time, and 24/7 there's a medical director on call. So if we ever get into a situation where we need some help or some guidance, they're there. But thankfully, because of our protocols and our extensive training, we don't typically have to, but they're always there in our back pocket
That's
if
nice
we need
to
them.
know.
Our
Yes, they do.
protocols are very broad ranging, allowing us to do a lot more things than a regular bedside nurse would do or an ICU nurse would do. So it's nice, we don't have to waste a lot of time calling the physicians all the time for routine things. And we always have the protocols to back us up.
So
it's,
Awesome.
super helpful, and
a lot of
and gives us
autonomy
a
in
lot of
this
direction.
job, a lot of autonomy. So, and very supportive managerial staff and physician staff, and it's a good job. So
It's a tough one, too.
It is
I
tough.
can't imagine. Well, folks, we're now here with Chris. Chris is actually a pilot here, and he's going to tell us about his baby back here. Thank you for being on the show.
Sure, thanks for
So
having me.
Tell us all about your ride.
So this is an EC-145 or an H-145 helicopter. This is what we use to transport our critical care patients. I can take a look inside if you'd like.
Oh, yes.
So speed is the name of the game with this. Like Ashley talked about inside, we typically try to get off the ground within 7 minutes of our call. And then we fly about 140 miles an hour, depending on the winds, sometimes less, sometimes more. So we can get from here, the Butler Airport, down to Pittsburgh in about 13, 14 minutes.
Oh, okay.
We typically sit with about 2 hours worth of fuel, which gives us around a 200 nautical mile range from this airport, depending on fuel reserves. The aircraft, fully loaded, weighs about just under 8,000 pounds.
Okay. Now,
and-
is this different than a regular helicopter? I mean,
in the way
basically
that
like
it's
a com-
outfitted inside,
Okay.
yes. So it is set up as an EMS interior. Some of these aircraft are used for search and rescue in different areas of the world. Some of them are used for transports, like out to oil and gas rigs. Sometimes they're used for not typically firefighting, sometimes police work they'll use them for. So they have a wide range of capabilities, but this aircraft, the EC-145 and the EC-135, which is a little bit smaller, are the more common ones you'll see in the US for medical work.
Now, when you were called out to a scene, not necessarily a hospital, but a scene, how large of an area do you require to set something like this down?
We typically ask for about 100 by 100 foot
Okay.
surface that's flat.
Oh, that's not very
Um,
big then. That's
so
pretty.
yeah, so we can get into some pretty tight areas. We can land on highways. We can land in softball fields, baseball fields, football fields. I've landed in folks' backyards if it's safe. So there's a wide range of capabilities that we can get into. Yeah.
Now, okay, like today, okay?
It is breezy today, but we can fly in this, no problem.
But you
yeah.
would just have to adjust
There's
to.
different considerations with the weight of the aircraft, where the wind's coming from. You'll have mechanical turbulence around the buildings in Pittsburgh that I'll have to consider. But yes, we can fly in this wind.
And now there's 2 seats up here.
Mhm.
So, but it's just you.
So we fly single pilot.
Okay.
And as the ladies talked about, we either have a nurse-nurse combo or a nurse-paramedic combo. When we don't have a patient on board, one of them will sit up front with me.
Oh, okay.
And that's just to have an extra set of eyes looking around for other aircraft, other obstacles, wires if we're going into a scene run. So anything like that, it's always good to have an extra set of eyes. So they'll sit up front with me when we don't have a patient on board. Once the patient's being transported, they're both in the back.
Okay.
Yep.
And is it always 3?
It is always 3. Sometimes we fly with a doctor, a resident ride along. Sometimes we have externs, people who are going through their training. So yeah, there's sometimes we have more, but we always have at least 2 nurses or a nurse paramedic.
Okay. All right, cool. Safety is important.
Safety is very important in this job. This aircraft can be very, very dangerous, you know, with the rotor spinning and the conditions and stuff that we fly in. So we're just gonna talk about safety real quick. We give this safety brief to all the patients if they're, you know, awake and alert, and anybody else that we fly, whether that be a pediatric patient's parent or an extern that we talked about, or any of our new staff or anything. Everybody's going to get a safety brief. So these are the doors here. We're going to show you the emergency exits when we get in. We always want to stay nice and close to the aircraft, okay? We always want to approach the aircraft from the front so the pilot can see us.
Okay.
We talked about that tail rotor in the back and how dangerous that can be, so we're always coming from the front. Going in and out of the aircraft when the rotors are spinning, we always want to acknowledge the pilot with a thumbs up. Are we good to go? We're giving him the thumbs up that we've closed all doors and we've secured all of our equipment. He gives us a thumbs up, we're allowed to exit the rotors, and the same thing to come back in.
Okay.
So now we're going to get in the aircraft and we're just going to go over the seatbelts and everything in case of a hard landing, so that, you know, everybody knows how to get out of the aircraft safely and that we're strapped in safely.
Okay.
Does that sound good?
Sure.
All right, so go ahead and we'll get in here. To open them up, we're just going to spin it, kind of grab the handle here and just
okay.
right. Yep, and it goes. So to practice putting it together, we're just going to clip it, and you'll just clip it. Perfect. So spin to exit. So then we're going to get in the seatbelt here. You can loosen it on the sides here so it fits you. Sometimes it's easier just to loosen it, and then we're going to tighten. So you got it clipped. That's some of the hardest part there. We want the seatbelt to be down at the pelvis.
Okay.
So put it the whole way down and then go ahead and tighten it, right? Perfect.
How do I tighten this? Oh, I see.
Just pull
I'm
that
sorry.
strap there.
I'm pulling the wrong one.
Yeah, that's okay. There, I know there's a couple
there we
there.
go.
Yep, so we just want that nice and tight and in front of our pelvis, okay?
Okay.
In the event of a hard landing, we want both feet on the floor, and you want to put your head straight back to the seat rest.
Okay.
Okay? So we're going to undo the seatbelt to be able to get out. Perfect.
Oh, that's neat.
And then go ahead and clip it back there.
Okay.
And all the seat belts back here are going to be the same. So as far as the emergency exits here, in this part of the aircraft, we have these 2 emergency exits. So this door here, and then this back left one there.
Back here. Oh, okay.
Yep, that little one right there. The clamshells are not a safety exit, so we cannot get out of those in the event of a hard landing.
Okay.
Right? So in the event of a hard landing and we're stuck in here and we can't open the doors the traditional way by turning the handle, we're gonna pull this red cap here. Yours looks exactly like mine does, and it's gonna let out a little strap, right? And so I'm gonna pull the strap, and it is gonna take this seal completely off the door.
Oh, wow.
And then I'm gonna push on the red dots, and that's gonna take the window out. The outside is the exact same. So I will have to pull this and get that strap. But then outside, it'll remove the seal, and then the outside, there's also 2 dots. You can see them down here, but they're not bullseyes on our side. They're bullseyes
on the other side.
And they're going to push, and they're going to open the window for us, so if we have to crawl out.
Oh, okay.
Yeah, so there's no smoking in here, obviously, but we do always go after that. And we have these nice safety briefing cards, just in case, you know, there's a lot going on. It just shows all the emergency exits of the aircraft, how to open the doors, and how to get out in the event of a hard landing. In the event of a hard landing, like we talked about, we're going to go out of the aircraft in the 10 and 2 position. So the front of the nose of the aircraft is 12 o'clock, the back is 6 o'clock, 3 o'clock, and 9 o'clock here. We're always going out at 10 to 2, and we're meeting at 12 o'clock.
Okay. All right.
Just because of those rotors spinning, we really want to stay away from the back of the aircraft.
So you have a plan then. That is what you, okay.
We also have 2 fire extinguishers. One is back there behind that seat there, and then one sits in between the pilots. We always say that those are for putting out people and not the aircraft.
Okay.
Unfortunately, they're not going to put the aircraft out. So in the event of that, we're going to use them on ourselves.
Right.
Okay. Do you have any questions for this safety brief?
Do not, but you know what? Speaking of safety, though, I think we should really stress how much the weather can really factor into what you guys do. They're very, very safe or to try to stay as safe as possible with the weather conditions and stuff?
100%. So our pilots aren't going to take a flight if the weather, isn't cooperating. So what happens when we get dispatched for a flight is the dispatch, which is our communication center in Pittsburgh, is going to send an alert to us through the base, which will come over the radio, which you'll see shortly. And they're going to say flight alert, we'll say Grove City, Pennsylvania returning AGH, right? And so the pilot is going to say code 5, which means I'm checking weather. So they're checking the weather, looking for any weather patterns that, is there any storms coming through? In the winter, we really care about moisture up in the air and icing, because airplanes can deal with icing, but the rotors of the helicopter cannot, right? And so if they think that it's marginal, maybe we can do it, they're going to call down to Shreveport, Louisiana, which is where Metro Aviation is. And that's kind of who they work for. And they're going to say, this is what I got, this is what I'm seeing, are we safe to go? And they may say, yes, you are, or no, you're not. So, if they're not, then they're going to decline it. And that's because safety is the number one thing. Like, we all come to this job, but we all want to make it home at the end of the day. And our pilots really, really stress that. So, thankfully, because of weather. Wind can also be an issue sometimes. Over 45 knots, it gets a little sticky.
Hairy,
Even at 30 knots, it gets very windy. So, the wind kind of has something to do with it. And then, like I'm sure Chris talked about, like weights and the heat and all that. There are a lot of factors that go into the pilot's decision. And it's all for safety, because we all want to make it home. At the end of the day, we want to do what's best for the patient. And if we can't safely transport that patient, then we need to find another way to get them there, because we all want to make it home.
And you want them to get the best care
Yes,
they can.
absolutely.
So, yep.
Yeah, absolutely.
Okay. All right, well, thank you.
Yeah.
Okay, folks, well, now we are actually inside the helicopter. And ladies, okay, show us. What do you have? What do you have in here that you can work on people with?
Yeah, so this is the aircraft. I mean, this is what we're working with when we talked about space and, everything that we can do. We'll first talk about this bag right here. This is our, we call it the trauma bag, but we pretty much take this bag in everywhere we go, into the hospitals, into the back of the ambulances, because it has a little bit of everything. We have some IV tubing, so we can start those infusions, an IV kit if we need to start an IV on patients. When KK was talking about needle decompressing the chest or doing the finger thoracostomies, for the collapsed lungs and the traumatic arrests, all that's in here. We talked about intubating patients and securing their airway. All of our airway supplies are up here on the top. And then we have like our blood pressure cuffs, our pulse oxes, our EKGs to, do 12 leads and stuff like that. All of that
That's
is
all
in
in
the
here.
stuff.
Oh,
It
my
is all.
Lord. Okay.
Yeah, it is kind of busting at the seams a little bit, but it does have everything we need in it. We have our IV pumps here, so if we need to start those infusions like we talked about. Everybody gets a little hearing protection because it's pretty loud up here. And
I was just going to say, I guess it would be loud.
yeah. And our helmets have our ear protection inside of them, but we also, can plug into our Carter boxes here. And this is how we communicate in the air, because if not, we wouldn't be able to hear each other.
Okay.
We're able to talk to each other, but we're also able to talk out to hospitals, to EMS agencies, to our medical directors, all through these
All
Carter
through that
boxes.
one there. Oh, okay.
Yeah,
All
yeah.
right.
And so we have our ventilator behind KK.
Yep. We have our ventilator. We can, if a patient is intubated, has a breathing tube down, we can set up the ventilator and do just about, any kind of breathing mode that they need or are on. We also have our monitor down there at the end. Obviously, everybody goes on the monitor. We can just monitor them. We can do 12 lead EKGs if we think someone's having a heart attack and diagnose that, hopefully, before we get to the hospital.
We have oxygen.
Yep.
So we have portable tanks there in the back on the clamshell doors, but once we get in the air, we can't use the portable tanks because everything needs to be secured. So we just pop them on here and turn up the oxygen. If they do need suction, we have suction capabilities, if we need to clear their airway or anything like that. Suction's over here. Back here we have our pediatric bag. So this is everything we talked about being able to do in pediatrics. We're able to take care of the pediatric patients here. This is our intra-hospital bag. It has a little bit of everything. BiPAP masks, another vent setup.
Some spare stuff.
Yeah, just a little bit of, it's our random
Connectors
bag.
for our ventilator.
But our most important bag is definitely this red one, and then for pediatrics.
Our medication bag.
Our blue
our
one.
medication bag is in the building, but it has all of our narcotics
Okay.
and medications
So
in
that's
it.
not kept on here? You bring
No,
that
because
with
we
you?
have to
Okay.
keep it, under double lock and key
Okay,
in there.
okay.
So when we bring it out, we usually put it under the head here. And
Yeah, and that's one of those things we say when, the tones drop, we got to grab. So we're grabbing our blood and we're grabbing our medications here. And then as far as like keeping the patients comfortable in different weather, obviously, we're in Western Pennsylvania, so we see a lot of it of weather. We have our summer foil blanket here, not super thick, but, with trauma patients, the one thing you really need to do is keep them warm. So, we're able to cover them with that foil to keep them warm. And then in the winter time, we have this life blanket, we call it, that is like thicker than a sleeping bag. Because in the aircraft, because this sits outside, it gets very cold. We do have a heater and we also have AC, but it can only do so much, right? So in the winter time, we cover the patients with the life blanket so that they stay nice and warm and, do our best to keep them comfortable and manage them till we can get them to where they need to go.
So now, do you do a, I hate to use the word inventory, but do you check, do you go through this and check it
yes.
periodically to make sure
every
that everything?
shift.
Oh,
We
oh
go
really?
through-
Okay.
We go through every bag, every shift, because even if, the crew before us had XYZ call and used stuff and they think they replaced everything, inadvertently they may have forgotten something. So it's our responsibility to make sure we have all of our equipment.
Okay.
And we have checklists for each bag and thing to make sure we have everything
Yeah,
with
so
us.
like the new people, that are just here, nothing gets missed, right? So
Okay.
we know left pouch netting is this, that, and this, right?
Okay.
And then we know how many of what and what's supposed to be there. But we also do monthly bag checks. They start on the 23rd of every month. And we go through every single thing that you see in this aircraft that is a medical
Oh,
supply or
okay.
equipment. And we check for expiration dates.
Right.
Oh,
And
on
so
everything.
anything,
It's
that's going to
tedious.
expire, we want to get rid of, obviously, and replace it so that we have it. We go through all of our medications. I mean, I'm talking every little alcohol swab in the entire aircraft and base. We're going through everything to make sure, one, we have it and it's there, but also that it's, not expired and it's working. We check these very thoroughly.
So you literally, do you cross every T and dot every
we
I
certainly
before
try
every?
to, yeah.
Oh, that's amazing.
Like we did our checks before you got here. We
Okay.
came out and did our checks. We usually sign on to a little Teams meeting with the other bases, and then we come out and we do our checks.
Oh, wow.
And every aircraft is laid out the same. If I go from here to another base, their bag is exactly the same
Okay.
as my bag.
So you can just
Things
go
are
right in.
Right, because you need consistency throughout, because we all travel between bases, and one base can't be rogue and put something somewhere else,
Okay.
and then nobody know where it is.
And you don't have a grace period. When you show up for work, you could get a flight within the minute you walk in the door. So everything needs to be the same so you don't have to, kind of reorient yourself. You got to be ready to go at all
So
times.
readiness at all times.
Yeah, absolutely. And yeah.
Okay, so folks, stick with us. I think we're going to actually see these ladies in action.
Oh God.
Stay tuned.
Thanks.
Flight 4, flight alert, for a scene run, Heath, Butler County. You're heading 228 for 8 nautical. Flight alert at 10:28.
Okay, we're gonna come up. It's gonna be tight, and then it'll open up.
Okay, oh my.
Couple bumps here.
Walk around's complete. Short power's disconnected. Doors, seatbelts, equipment secured in the rear.
Yep.
Good up front. Transfer pumps are on. Autopilot's on. Number 1, number 2, both to fly. We clear on the left.
We are clear on the left.
Clear right. Do have a dispatch number. Get our cell phones.
Yep.
Okay. Text please. Throw cockpit. Overcheck.
taxiway Alpha will be right closed traffic, Butler. Control, LifeFlight 4.
LifeFlight 4.
Off Butler, 5 minutes local area will be 5 on board, 2 hours fuel.
LifeFlight 4, that's copy, 1047.
Alright, you guys are good, so
Thank you.
over
Okay.
a quick little ride, whatever you want to talk about.
Thank you. Okay. So then you would be working on your patient
Right.
immediately as soon as you start? Okay.
Yeah. So a lot of times a scene run, we're rarely at the actual scene of a crash. Like usually they're landing them in a safer landing zone, like a baseball field, a parking lot, somewhere that we have approved as a safe landing zone. So we will get in the back of the local ambulance, get report from the local EMS,
Okay.
try to do whatever hasn't been already done by them to get the patient stabilized enough. So we try to get as much done before we actually bring them into the helicopter.
Okay.
That's not to say if your IV falls out or it infiltrates or something, we don't start an IV on you en route or intubate you en route if needed. But we try to get as much done before because it's just so small. You
It
know,
is.
that
It's very tight. Now, does
Tight.
this seat move or something in
It
order
can
to
move, but usually, you know, this is my.
So this is your
My
workspace
limited.
right here. Wow.
Yeah, we would just lay you flat.
We would lay you
ask
flat.
the pilot permission to unbuckle,
Yep.
to perform whatever we need to perform, and then do what we need to do, and then get back in our seatbelts so that we're safe again.
Okay. Okay, now I've never been in a helicopter before, so we're just a little jiggly. Is this like normal?
It's very windy today,
Okay.
so it's usually a little smoother
Okay.
than this. All the vibration is normal,
Okay.
and especially when we land, you'll notice a lot of vibration,
Okay.
and that's very normal. A lot of what I do in this seat, if somebody's stabilized, I do a lot of hand holding because they're terrified. You know what I mean? So I'm a hand holder, and sometimes
That's
that's all
very
they
comforting,
need.
though.
I mean, sometimes that's all they need.
I'm about to start heading back. You guys, you want more? You got everything you need?
No, I
or-
think we're good.
Okay.
We are good.
David, you good?
I'm good. I could use a little hand holding though.
Oh, well, there's Ashley right there.
Well, I have this over here. I'm white knuckling this.
Are you
so
really?
I'm
See, I can hold your hand. It's all good. It's all good.
Traffic Skyhawk, November 13337, breaking off the approach low left downwind 26, looking for RNAV traffic, full stop, Butler. Allegheny traffic Skyhawk, 13337, midfield left downwind 26, full stop. Copy, LifeFlight 4, 1103.
Well, folks, I hope you enjoyed the show. I know I did. It was a really big plus getting to go up in the helicopter. We weren't expecting it. So a big thanks to Ash and to KK and to Chris behind me for making this a really great show. As I said, I learned a lot, and I hope you folks did too. You know what to expect if you're ever in this situation. So again, hope you enjoyed the show, and remember, keep smiling, keep dreaming, and keep watching.
So corny.
It is.